My goal today is primarily to give us some sort of information to think from as we're trying to struggle with a frustrating problem, a very complex problem as it turns out. Doesn't seem like it ought to be, just to have baby pig diarrhea, but the causes are many, the risk factors are many, and sometimes it's helpful to have a little bit of an idea of why we see what we see and what are some of the interventions. And personally, I like a history. I mean, I kind of like to know where we came from to help define how we got where we are. And of course, over the years, there's been a tremendous amount of change, and this change is incremental. Sometimes we notice it, sometimes we don't. But change in nutrition, housing, genetics, the environment we provide for the pigs. A lot of things are happening all the time. And so then we start to think about, well, when I grew up, this was normal. Well, now it's not. Normal is what I was used to. And so the idea that, we've got to be able to adapt what we can perceive to be normal or standard practices, into a mindset of continuous improvement. And I think it's really helpful for all of us to step back every once in a while and go, why am I doing that? Why do we do it this way? And I'm probably getting a little feedback already. And so that gives us the tools to start to analyze and determine what might be of benefit. And hopefully, if we're going to make a change, we can do that in a systematic way where we can demonstrate a real change, with some sort of control. When I was a real vet in 1978, I'm actually older than Dr. Tom. Not any wiser, however. A lot of organisms were out there that were causing diarrhea in baby pigs. The E. coli, salmonella, some have been known for 100 years, right? And quite honestly, we had a pretty good idea how to control these with either vaccination, elimination, or maybe a little change in the environment. And rotavirus A has been described for over 50 years. That's supposed to be the focus of this talk, but you can't talk about one without talking about all the rest of these things, because they're all tied together in the pig gut. Then it got harder. I left practice and things started to fall apart, PRRS being one of those things. And then we start having the introduction of more technology, more science, so we can find more stuff wrong. And the Clostridium perfringens type A, the difficile, rotavirus C and B, in addition to type A. We got PED into our herd. We've all been through that. Seneca virus. All those things can contribute to onset and diarrhea flare-ups. And I think it's just gotten a lot more complex. I would say that TG, PRRS, and PED are the things that we probably need to eliminate, if at all possible. You're over here in an area that's a fantastic place to get rid of those endemic diseases. But the rest of those we're pretty much going to have to live with. When I say eliminate TG, PRRS, PED, what I'm really saying is we got to keep them out, right? That's your external biosecurity, the diligence in doing that. That's huge. The rest of these bugs that are on this list and some other ones are pretty much always present. And so we're going to have to deal with them. And if we stomp on one, it's the gopher game. You stomp on one, another one pops up its head, unless we're doing something that's fairly broad and generic in trying to control these diseases. So Wesley says I'm supposed to provide the secret of controlling these diseases. And we play football over in Iowa. I don't know about Illinois or Indiana, but I thought a football analogy just springs to mind immediately with the old Vince Lombardi thing of football's only two things, blocking and tackling. And he was a pretty successful coach. That's been expanded on. I like the one, the secret is there is no secret. It's the basics, blocking and tackling. Wins come from flawless execution of the basics, the blocking and tackling every day. And that's always the hard part, because that thing called complacency sets in and we start to cut a few corners. What I'd like to do is just kind of digress a little bit into the biology or science, probably most of which you know, but it doesn't hurt to be reminded of. When a pig is born at birth, it's basically sterile. There's no bugs in it. I would maintain there should be no bugs in a newborn pig, viruses or bacteria. Immediately, it's colonized with bacteria that'll achieve billions, in terms of billions of population numbers, within 8 hours. And there's this succession of bacteria that are coming in and fighting for a niche over time. And so the E. coli, then the Clostridium perfringens, then the Clostridium difficile, Bacteroides, Bifidobacter, and one of 1,000 other bacteria that are in the microbiome keep coming in and trying to establish a niche. And so there's a very, very dynamic fight going on there early on in life. The pig does have a few ways of fighting that. Normally we think about pig resistance and we need to have more immunity. Again, PED brought this really home, that there's really two types of immunity that this pig that's absolutely devoid of any immune function at birth, there's two ways that it achieves some sort of immune resistance. One being colostrum. We know the importance of that, making sure that it's absorbed and available on that first day to get IgG. Then it's done. It poops out. Antibodies absorbed into the pig, and that maintains over time, but there's no more colostrum in that milk. The other arm that became really evident during PED is the mucosal immunity, the ongoing immunity that you get through milk with IgA. Every 4 hours, that pig needs to get a mouthful of milk to continue to bathe the gut with the immunoglobulin that's coming through the milk. And it's a different kind than what was absorbed at birth. And I think it's really important that we think both of those factors when we're trying to implement some sort of a control strategy. Another thing that's kind of unique about a baby, these are babies, these are infants, right? They don't have their crap together yet. When they're born, their villi that are in their intestine are extremely long, a lot of old cells that are susceptible to a lot of colonization with bacteria and such. It's like a shag carpet, right? Really long shag carpet when they're born. And over time, it's naturally going to get shorter in shag, but when they get infected with a virus, particularly, it's going to come in and just trim that shag right off so there's no shag left to it. And so they got that problem. They can't grow that epithelium back as fast. The colon can't compensate by sucking the water out. The purpose of the colon is to suck the water out, right? So you get formed feces. The colon can't do its job. Water goes on through. So, I mean, it's a very simple concept, but important to recognize that these pigs are special. They're infants. Another little bit of physiology here. If we look at if the intestine is pushing stuff through from left to right here, they're being inundated with bacteria from left to right here. Peristalsis, or the waves of moving that material through, have to occur with a very orchestrated pattern. And it's very important that happens to keep moving. This represents the intestinal surface here with villi. These are all bacteria along with the milk and the lumen right up here. And so you can see there's an interface here of, if we keep this moving, we can shuck some enzymes out here, get some digestion going, absorb it across the epithelium, but we're going to keep the bacteria flowing through because, we don't want them to build up to a high population, etc. I think it's so important to stress that because chilling or heat stress, but particularly chilling, is a huge, huge compromiser of how that gut's going to move stuff through. And so, anytime we compromise that pig's ability through environmental mismanagement, we're going to expect problems. For the mathematicians in the audience, there's such a thing as, I like this formula because it relates the risk factors that are involved pretty well. Looks like I started it late, didn't I? I didn't start it. Severity of the disease. Dose of the organism, whatever it is, times the virulence, how hot, how pathogenic is it. Those are directly related to severity. Animal resistance, we're talking a little bit of immunity, we're talking a little bit about environmental stress, right? That's the only really defense that the animal has against disease. And so, of the things that we can influence, dose is number one. I don't know if your veterinarians tell you that a clean farrowing house is pretty important, but a clean farrowing house is pretty important, right? This is an OB ward. These are babies. So dose can be controlled with hygiene, sanitation. Virulence, we can't do a hell of a lot about that, right? The bug is what it is. And so with the virulence part of that, I'm back to, if it's a real bad bug, external biosecurity, whether you're talking APP and pneumonia or whether you're talking PED or PRRS or whatever. We know that that's an important part. If you don't have it, don't get it. Bottom line. Then we go to animal resistance, and again, we touched on this immunity thing, the passive immunity acquired through colostrum and milk, both very, very important. And then, of course, over time, the baby pig can start to respond with its own immune system with an active immune response. And so a lot of times, that's where we stop because, hey, doc, don't you have a shot for that? You know, we need a vaccine. We're really dependent on that in our minds as maybe a kind of a crutch. But animal science has some thoughts, you know, there are some considerations as well. And risk factors for disease expression. We're going to touch on that in just a little bit. If we were to look at animal science factors, risk factors could include you know, the temperature and chilling. We talk about peristalsis, and chilled pigs get diarrhea. We may or may not find a bug in there. Generally, we always do, but it may not be the bug that started it as a risk factor. Another way of saying that is approximate cause. Oh, what's causing the disease this moment? Oh, that's E. coli. What's the ultimate cause? Well, the little fart got chilled last night. You know, that's the ultimate cause. And I just like to have you have that concept of these bugs that are in the facility every day of the year don't have to cause disease. We set them up to fail, these pigs up to fail. And certainly there's other factors, the genetics, nutritional status, all the things that I don't know anything about, I know are important. Robust animals tend to be more refractory to disease. And so herd immunity, we're talking about that immunity thing again with management of colostrum. And I think a big part of that herd immunity goes into the acclimation and vaccination of gilts and sows. And I think Dr. Lyon is going to update us on that, so I'm going to stay away from that topic. But that is foundational for establishing herd immunity, is getting those gilts acclimated to the recipient herd. Okay, from the back, you probably can't read this, not that it matters, but I said earlier that PRRS and PED probably are things that you don't want to have, you want to eliminate. The rest of these bugs we find in every pig that gets submitted, pretty much. E. coli, Clostridium, Rotavirus, Isospora occasionally, the coccidia, and occasionally Salmonella. But these top bugs here, we see them virtually, you know, in most of our submissions. We can find the bug. It's like the old parts per billion, parts per million story. You know, we have the tools to find the bug now, so we're going to find it. The question becomes, is it important? This chart probably gets way too busy too quick, but I put it together some years ago. Just my perception of what's happening here is that a lot of times we have a diarrhea flare-up or somebody notices that the pig weights are getting smaller, and so, you know, get on the horn, talk to the vet. The vet says, hey, we got to get something to the lab. You send something to the lab, we got to get a diagnosis because we got to call it something that's causing this, right? And so in the lab, we have really cool tools to find the E. coli, the Clostridium, the Rotavirus, the PRRS, whatever, right? What I can't emphasize enough, really, is that's just one arm of the environment and the maternal factors and the management and nutrition and water that can contribute to disease processes. One of the things I don't think we give near enough credit is this I don't know category down here. Either I don't know or I didn't look, right? So we have this bias, so we're going to find something infectious so we can give it a shot and fix it. The unknown and not observed is really, really tough. And we can learn a lot just by looking. There's an old adage. And so that's part of that diagnostic workup. Diagnosis to me sounds like cause, right? So if we're going to assign cause, how do we do that? And this is just an example of the difference between cause and correlation. Because we find something and can correlate it, does it mean it's causal? On the blue dot or blue line here is cases of autism over the last 20 years, thereabouts. They've just been rising steadily. You know that just by reading the paper, right? Going to the internet. The other, whatever color it is, line, reddish green, something or other, is sales of organic. I'm colorblind, if you can believe that. But it is sales of organic food. And I go, really? I think we've got the cause of autism, right? It's a correlation, but it's not causation. And I think we trick ourselves sometimes when we're thinking about, oh, we found this, that must be what it is, that would be my bias anyway, so, but it might be just correlated with an event rather than causing an event. So what we do in the diagnostic lab and what you do in the field as producers and observers and caretakers and veterinarians is we want to work together to try to achieve an accurate diagnosis in a systematic process. You're in the field collecting information, making observations, reporting what you see, counting this, checking out that, and reporting that type of information to somebody that's putting the information together. You're probably going to submit a case. Maybe we're going to get some diagnostic results, and we're going to think about this. Does this all make sense? Most of the time we get, I would say, 80 to 90% accurate, which means we have to continuously refine and improve the process. And so it's a circular process. What happened a month ago isn't necessarily what's happening today. And this is what I think producers and animal caretakers excel at, is looking at pigs. No matter what the situation they're in, they're pretty good at characterizing what they see and the deviations from what they're used to. And those are all very important to report. Report to who? Well, whoever you're supposed to report to. Move it up the chain so people know what you're seeing and thinking that are abnormal in this particular situation. Then, as a veterinarian and diagnostician, this is where I go. I need to cut one open and try to get an idea whether it's nursing, got a full stomach, able to absorb milk, got the white streaks in here, whether it's really diarrhea or maybe even the pig's starving. We don't know until we look. And so we'll open them up. This is a test tube, just a blood red top tube that I dropped a little piece of small intestine into and filled it with just plain water, distilled water. And you can see the little villi, I think even from the back, that are starting to make that look like a shag carpet. And you go, oh, well, at least that's intact. It doesn't look like PED or a virus, as opposed to, this one down here that has had its shag cut really close. So we got some subgrowths or some things that we can kind of look at when we're in the field. But more often we're going to go to the laboratory with a submission. And does it have to be fancy? Does it have to be a lot of stuff? No. I think the important thing for anybody, veterinarian or producer, is to understand we need feces from very acutely affected pigs, tissues from very acutely affected pigs, and when properly put together with a little bit of formalin and then chilling some feces and intestine, we can rule out virtually every organism that's involved, infectious organism that's causal for diarrhea. I have PRRS highlighted on here again, simply. A lot of our flare-ups, we're going to talk about rotavirus flare-ups here in a minute. A lot of the flare-ups of diarrhea that occur in Iowa, PRRS capital of the world, are a reintroduction or reemergence of PRRS or maybe Seneca virus. And so we can't have the blinders on just thinking, oh, this is rotavirus again, because sometimes it's not, right? And so that's where the keen observation of caretakers comes in to go, well, this seems a little different. What about this? Diagnostic submissions, I think, have some value because sometimes you're surprised by what you do find. It may not always be, classic example last week were some coccidiosis cases that were coming through from a nursery as well as the farrow house that, we didn't know we had that before. And that was assumed to be rotavirus, but it wasn't. So, you never know unless you look. Very briefly, what are some of the things that do cause disease? Well, E. coli. We got that one. We can detect it in every pig or every submission. We can detect it in every single submission you send us, right? So how do we know if it's important? Well, we can look in the microscope. If we collect the tissues properly in formalin, we can look at the microscope and see the little boogers colonizing the edge of the epithelium. That's one way to do it. When we isolate that organism, here's an antibiotic sensitivity. One question that should go through your head is, well, how do I know that's really a pathogen? And we do have the technology. This is one place where I'm not a big PCR guy or dendrogram guy or whatever, but this is one place where it's actually useful to know if the E. coli we isolated really is making a toxin that can cause diarrhea and is really making a pilus that allow it to attach to the epithelium. So using a little basic science there, we can put together a firm diagnosis when we find it versus, oh, we found E. coli, here you go. We're the E. coli lab because we always find it, right? Well, it needs to be in context. Blocking and tackling. To fix E. coli in the old days, yeah, we cleaned up the environment and we had an effective vaccine. That's pretty cool. So it's a two-pronged approach. Clostridium type C, red necrotic guts, can't miss it, probably don't see it much anymore. Occasionally we do, but you can't miss it. It's a real disease. How do we fix that? Blocking and tackling, hygiene management, environmental control, vaccination. Hey man, veterinarians are winning now. We got vaccines, right? We're making it work. How about coccidia? These little coccidia get within the epithelial cells of the villi here and burst them, and it acts about like a TGE or a rotavirus in terms of damage to the gut, and diarrhea occurs. It's very much a dose-related disease, right? And there's really no vaccine, there's really no good treatment that's really labeled for use anyway. Responds really pretty well to hygiene. I just want to illustrate that point. Over the years, as we consolidate the industry, get better at biosecurity, cleaning, hygiene, fewer farms, bigger farms, standard process, you see the number of cases of coccidia steadily going down. 2013 or 2014, or here, 2013 we had about 35 cases. What happened? It went about in half after PED broke. You know, again, I think that sanitation thing and internal biosecurity is huge in preventing coccidia. It shows the power of being clean, right? And so the blocking, tackling, again, is all in the hygiene environment and management, not in a shot. What are some of the things that people do? I mean, obviously, for decreasing dose of any type of agent, bacteria, virus, otherwise, coccidia, you know, we got them up off concrete or wood. That was pretty easy. That's been done for 30 years now. All in, all out management. People are getting better at that, and we really mean all in, all out with cleaning and disinfecting in between, that sanitation in between. Lots of degreasers. You know, the biofilms that we talk about, those are real. Some of the stuff that's out there being peddled as nostrums, you know, I go, where's the data? But biofilms are real, and we've known that for 20 years. And we need to break down those biofilms. So the cleaning agents that you use, the soaps and the degreasers, which I'm not an expert in, but they're really, really important, along with appropriate disinfectant. Mats, mat management. They're just like a haven for keeping bugs around. Are we managing the mats properly? Do we wait till tomorrow, or should we take them out today? Right? Do we adjust our lights today, or do we wait tomorrow and see if it's a different day? Cross-flap string pigs, etc. So those are some of the blocking and tackling things that we're talking about. Clostridium difficile. Again, because we could find it, horses and cattle get it, and we could find it, we started diagnosing it. No vaccine for it. Is it really new? No. Is it different? Maybe. Is it anything that we consider to be a primary cause of disease? Probably not, because when you do some of the blocking and tackling, it goes away. Okay? I hope I'm making... I'm probably being redundant. I know I'm being redundant. I'm sorry. But it's basics. Clostridium type A, statement I'm going to read about Clostridium type A, there is no consistent experimental model using biologically achievable inoculum numbers to evaluate pathogenesis, treatment, and control. In other words, we can't reproduce disease with this bug if we give them the buttload of it, right? We can't reproduce disease. It's a bug that we can find easily, high numbers. It may be contributing, but we don't have a clue how, and we don't have, in my opinion, a shot that we can give them for it. It's back to the blocking and tackling to control that disease. You see the pattern developing. Viruses. I'm going to just kind of put them together. TG, PED, rotaviruses. They're kind of the same thing, only different. They do the same thing to the gut. And there's really no cross protection between the different types of rotaviruses, group A, group B, group C. or between the different types of coronaviruses. One doesn't protect against the other. What do viruses do? Again, we're looking at the intestinal wall microscopically with these long villi that are stained brown right now. They're stained brown because they're all infected with a virus. Which virus? Could be PED, could be TG, could be rotavirus. They all do the same thing with about the same severity. We just had 70 CD pigs we put into isolation at day 1. And by day 6, all 70 were dead, just like PED had gotten into them. But it was rotavirus type A. It will kick their butt. I guess I say that, don't I? Acting alone in susceptible pigs, rotavirus, they all will kick the rear end off these pigs. And 36 hours later, those villi that were nice and long back here on this slide are gone with just a little bit of virus left. It's telling you a couple of things. One, the villi are gone, the damage is done. The virus is not in the pig gut anymore, it's now in the environment, right? And how much virus? Billions and billions of virus particles have been spewed into that environment. So that's a critical thing to keep in mind as we think about what are we going to do with feedback or control, right? Blocking and tackling. Eliminate PED, TG, rotavirus, we're not going to get rid of. PED, TG, got a list of stuff. I'm sure you all have it on the door somewhere. External biosecurity, keep it out. Don't get it. If you got it, get rid of it. About that simple. Vaccine, take-home message from what we learned from PED is even with a disease like that, if we give a sow a shot that's never seen the virus before, her pigs will die. Her pigs will die if they get PED, right? It's not very protective to give an injectable vaccine to a disease that's affecting the villus, right? So keep that in mind as we move to rotavirus. Really busy slide. If you want to know about rotavirus, we could read through this slide, of all the viral proteins and the inner layers, outer layers, cores, or whatever. Key things about rotavirus, in my mind, are really resistant to the environment. It's more resistant than PED, right? It's a non-enveloped virus. It's very resistant in the environment. We will never get rid of it. Okay? It's always going to be there. It can cause disease just like TG or PED in susceptible pigs. Can also operate with a little E. coli-like mechanism and cause hypersecretion. So it's a tricky little booger. And there's multiple groups, A, B, C, that are not cross-protective. And within those groups, there are multiple serotypes that are not completely cross-protective. And it's like, really? Well, which one would I vaccinate with? Well, take your pick. There's another one to step in and take its place, right? It's not going to work. Probably. We call it influenza of the gut. I don't know how lucky you guys have been with vaccines with flu. We're getting better at them. But, historically, if the virus changes, the vaccine loses its effectiveness, right? So it would be predicted with rotavirus. Rotavirus, how many cases do we see? Well, in 2007, we found at about 10% of the cases that we were doing. And see how this goes up so dramatically when we start doing PCR in 2009. Well, University of Minnesota is doing PCR that not only detects group A, but group B and C. Well, we need to do that too. So 2011, we get group B and C included in our PCR so we can detect all three. Man, our cases go up. Isn't it fantastic? Sensitivity of detection. We can detect didn't we say it was everywhere? Pretty much. And so we can detect it very easily. So positive cases don't really help you. Yeah, they found rotavirus again. Yeah, we expect to. Okay? And pretty much a function of the test method that we're using. Do we find A more frequently than... Yeah, probably A more frequently than B. 3 times more frequently, about the same as C. A tends to be crossed ages, but more common in 3-week pigs. C tends to be crossed ages, but more commonly in less than a week. You put any of these viruses in a 1-week-old pig, they all cause the same level of disease. So you can just kind of put them in your hand and call them a group of viruses that are immunologically different. If we just look at the number of positive tests over time, and this is actually this isn't over time, this is by season. It's present every month of the year, between 70 and 90% of the cases we test. It's very, very common. Diagnosis then. If we really want to diagnose rotavirus presence, we use PCR. Yep, it's positive. Here you go. If we want to diagnose whether it's actually contributing to disease, well, then we got to think about, now, are the clinical signs typical? Did somebody actually look? Now, what pigs are we choosing to do that? We detected it with a PCR, probably. But the real clincher, to me, are actually twofold. One, do you have microscopic lesions like, oh, they've got an atrophic enteritis, that's typical of a viral infection. We found rotavirus. Okay. But did we try to rule out anything else? And so I think that's why we end up doing more than one test just for rotavirus. You know, we want to make sure that PED isn't there, or TGE isn't there, or E. coli or coccidia aren't there, contributing at the same time. And that's that rule out others part. So to me, that's what it takes to make a good diagnosis. Some of our astute veterinarians will use PCR cutoff values. The lower the value, the more virus is present, so the lower the value, the worse it must be. Lower value, the more likely it's important. And that's probably true if you know which pig it came from. If you specifically sampled an acutely affected pig, that's probably true. A lot of times, we're taking a few chronic pigs, that PCR value may change. They might have had rotavirus 2 days ago, lots of it, but now it's all flushed away. And so the PCR is going to be lower, right? Or higher. It's going to be less informative. So that's why I think to really take this diagnosis home, we need to do specific laboratory testing that includes histopathology. Risk factors, we're always looking for those as part of our diagnostic workup. I'm not doing that. That's what Wesley's doing. That's what you guys are doing in the field is what changed? How come we've got more problems with diarrhea now than we had yesterday or last week? Could be the gilts. Maybe we didn't get them acclimated, but it also could be that fan that's dirty or the drafts or the change in temperature and season. What about vaccination for rotavirus? We already said PED didn't work really well. Where are the data for rotaviruses? There's a few out there that we're trying to do, but we really don't have any good data on the vaccine. And I'd like to see it. I know a lot of people are using it. So basically, I come back down to doubling down on the basics of the hygiene and environmental control. What about feedback? We all do it. We all do it for different reasons, different ways. What's the science of feedback? First, I'd back up and go, how do we ever think feedback could be important? And it really boils down to three illustrations, I would say, that are really fundamental to understanding why we do feedback and maybe how we should do feedback. One is TG in 1946. They figured out, hey, we expose all the sows, shut down the herd for 30 days, TG's gone. We have complete immunity. So let's expose everybody. That's feedback with an epidemic, with an acute disease that was newly introduced, right? So that's one way to use feedback is let's expose everybody and get herd immunity complete. Along came Kohler in the 70s and said, well, how about E. coli? If we grow up a whole lot of E. coli and feed it back in a milk vaccine so that they're getting, probably 1 million times more bacteria than they would in a little scoop full of pig poop. I wonder if that would help. And indeed it did. So the E. coli vaccine required a high dose fed back, right? High dose fed back. The third application really was for protecting the unborn fetuses. Parvovirus, mummies, stillborns, SMETI, that type of stuff. If we fed back to gilts before they're bred, we could prevent mummies and stillbirths. Three fundamental concepts. 2 of those were applied to suckling pigs, trying to save more piglets. The third, the parvovirus thing, is applied to gilts prior to breeding to try to prevent fetal loss, right? So you got to separate these concepts out. It's not all one size fits all, okay? And that's what I'm trying to kind of be simple, but at the same time give you a sense of complexity. Is like, every generalization is wrong, probably including the one I just made. So anyway, we got to think about what we're doing. What do we really know about feedback? Nice field study done by Robbins and Beyer, reported to ASB. No statistical difference in outcome over a year period. Feedback can contain agents that are unexpected. Oh, well, how would we know that? Well, if you look for coccidia in your feedback, would you find it, and is that a good thing or a bad thing? If you look for circovirus in your feedback and find it, is that a good thing or a bad thing? So that's her point is, man, there's erysipelas in there and we didn't know it. Aruda did a controlled study, no difference measured in colostrum, sows or pigs' diarrhea in the colostrum of sows, or antibody in pigs, or diarrhea after feedback containing Clostridium, E. coli, and rotavirus. We measured and determined that Clostridium, E. coli, and rotavirus were present in the feedback, but we couldn't measure a difference in the sows or the outcome in the piglets. So the science isn't really good. Why is that? We have a tendency to think about one bug. We're focused on rotavirus, but man, there's a whole lot of bugs that we know the names to and a whole lot more that we don't. Those are all potentially in that feedback material. Those are all things to which sow herd immunity has to be engendered. And so the sow has a lot to worry about besides just a little bit of rotavirus or E. coli in a feedback material. She's going to be responding to whatever has the most severe consequences today. Backing that up then, what are the objectives of acclimation? One of them that I thought about, Dr. Lyons, was we want to assure primary exposure to bugs in the herd before they enter the herd. What's the objective of feedback? And the sense I'm talking about, well, yeah, primary exposure if we're talking an acute outbreak of PED, but we also are using it, I think, to try to booster existing immunity, like a booster shot. Booster shot requires high antigenic mass. Are we achieving that? I'm not sure. Boostering a previously infected, exposed animal requires a high dose. We learned that with the E. coli. A high dose. Okay, so feedback, we need to do it with a high dose. Does that mean we collect a few quarts and dilute it 1,000 times and spread it out over 3 days? That's not a high dose, right? Okay. Can feedback spread bugs or increase persistence of some of these things in the herd? I don't know. Probably not very often, but probably can. Would that be a good thing or a bad thing if you want herd immunity? I don't know the answer to that either. Is there a downside? Probably. If you got a lot of salmonella in your feedback, recent introduction of a new strain, that's probably a bad thing about feedback. But if we're talking rotaviruses and E. coli's and smetiviruses and whatever else, maybe that's not such a bad thing, unless we pump the pit into their troughs or something like that. Then we might have an overwhelming dose of something we didn't expect. So I mean, these biological systems are pretty robust, but we can mess it up if we try. So, another point that I'd just make, we want to booster immunity by giving them the disease again, so to speak. Boostering with a shot of killed product, large antigen mass, that's going to probably stimulate immunity, but we're feeding it to them, right? There's a lot of obstacles. There's a lot of obstacles in preventing these invaders from actually crossing the mucosa and getting in to stimulate an antibody response. Basically, just trying to illustrate that this is not easy for a rotavirus given to a sow to actually replicate and generate an anamnestic or boostering response. It's really hard. She doesn't really care. It's like flicking a gnat to her, right? So slight perturbations, i.e. giving them a little bit of feedback, may not boost her immunity. No need to call in the reinforcements. Okay. So, if I were going to feedback, what and when would I do it? For rotavirus, I think there's anecdotal benefit. I'm not advocating don't feedback. I'm just trying to suggest that maybe we need to think about all the factors that go into it and trying to be a little smarter about it. Feces, we already said, lots of the virus is already in the feces, right? If they're clinical, it's not in the guts, it's not in the lungs, it's not in the hearts, it's not in the brains. It's in the feces, right? So getting feces collected from acutely affected pigs, if possible, and giving it to sows 10 to 14 days before farrowing, because we want to stimulate that. If it's going to stimulate something, we want to stimulate it so that it's coming out in the IgA and the milk over the next 3 or 4 weeks of lactation, right? Okay, we don't care about colostrum with this disease. We don't care about colostrum. We care about the milk immunity, okay? So that's why I would say 10 to 14 days before farrowing. Source, fecal material, fecal wipes, processing carts, anything with piglet poop in it would probably be a pretty good choice. You could use macerated gut tissue from dead pigs. By then it's usually gone pretty well from those pigs. One thing, and I don't know if anybody's doing it in this part of the world, but taking a few piglets and not letting them have any milk or colostrum, but infecting them with some virus, some feces, and then letting them incubate for about 36, 48 hours and harvesting those to make the little fecal cubes, if you will, like we did for PED. I don't know if you've done that, you're experiencing that, but what you're trying to do is really gin up a really high dose that you can feed back to them. And when you think about it, doing that method, you're going to have at least 1,000 times more virus particles per unit if you create the inoculum in that manner than if you just rely on chance by picking up feces. Okay? If I was trying to protect unborn pigs, like from congenital tremors or parvovirus or smetivirus or something like that, I probably would use hearts, lungs, and entrails. But I wouldn't feed it to gestating sows. You could overwhelm what immunity they got. You'd feed that back to either acclimating gilts or non-pregnant sows. So feedback, one size doesn't fit all, right? That's the take-home message. Is you got to understand the biology, I think, before you can just willy-nilly expect something to work. So if doing feedback, I'd urge you to go, what am I trying to accomplish? Write that down. Dose is important. Hopefully I made that point. A high dose is better than multiple doses if you're trying to boost your immunity. One big dose done right is probably better than multiple doses. Timing is probably important. If I'm trying to stimulate immunity to cover that piglet through the suckling phase for gut pathogens, I think 10 to 14 days prior to farrowing is probably a better choice than 5 weeks before farrowing. If I'm trying to stimulate more influenza antibody or something like that for a systemic infection, probably vaccinating at 5 weeks is better, right? So what's your stated objective? Use your veterinarian to sort of sort out now what would be the best approach for what gopher I'm trying to hit today is, right? What are the risks? Always need to talk about that. What's the material going to contain? You can dilute it with cold saline, dilute this fecal material or whatever the material is with cold material, and use it either immediately or maybe refrigerate it no more than 3 days, I would say. A good refrigerator. And you could probably freeze it for future use, because one of the problems is sometimes you run out of inoculum to try to feed back. And sometimes I wonder if just being tidy, spending a little more time and effort on cleaning might be as good a use of resources as getting a fancy technique put into place. So, if it's not TG or PD, fall back to basics. Do the checklist. Mike, what time we got? We're done? We're done. Okay. Same thing, blocking and tackling. You can't read this, but I was just trying to think, how does our bias enter into our decisions? Should you eat that bacon? Well, do you want to feel like angels are frolicking on your taste buds? Yes. Well, then eat it. Well, no. Well, then you've clearly never tasted bacon, right? Or, yes, but I'm afraid bacon will kill me. Are you a coward? I'm not a coward. Well, then eat it. Yes, I'm a coward. Bacon will turn you into a true warrior. Okay, so point being is, we're kind of guided by what we believe.